I was an emergency room doctor. This was about 21 years ago. And there was a woman from Mexico, I'll call her Mrs. Martinez, who was in the hospital with a metastatic cancer of her colon. And I was asked to go in and see her and see if the cancer had spread to her brain. The test came back and it showed that, yes, there were spots of cancer on the brain, but there was no brain swelling. She was responding well to the medicine. My job was to send her home. And I was not going to tell her the result of the test, but I was going to leave that for her regular doctor who was going to see her to tell her the next morning. So I walk in and I said, Mrs. Martinez, the test result looks good. I see that you're feeling better. And then we'll send you home to see your doctor, Dr. Yu. And she said to me, Doctor, what was that brain test result? And now I could not withhold that. And I said, and I realized it was not just the kind of information you give, well, you know, your potassium is a little low. Here, go eat a banana. And so I sat down and I said, Mrs. Martinez, the test shows that the cancer has spread to your brain. And before I could say anything more, her face turned white, like the wall of my room or the wall behind Raju or some of you. And the blood drained from her face. And then I thought, oh, what could I possibly say to respond to her? This is not something I can just fix. I'm not going to be able to just cure this. What could I possibly say? And so how did I know what to say? I asked her, Mrs. Martinez, what is your reaction to this news? And she said to me, it is a death sentence. So now what could I say? And this is a moment which comes for all of us when we're suddenly, here I am, I've said yes to be with her. I'm sitting across from her. I've already committed myself to be with her. And I don't know what the heck I'm going to say. Nothing in my training has prepared me for this. Everything in my heart has brought me to this moment, but nothing in my training. So how to proceed? And she says it was a death sentence. And I think to myself, well, maybe I could reassure her. So I said, Mrs. Martinez, your doctor has a lot of experience with this. I will make sure that you see him first thing tomorrow. He knows you and you know him well. And I'll make that call tonight. I thought, well, this is strong, reassuring. It did not faze her. So then I thought, well, then what could I say? I can't say, well, I know how you feel. I can't be psychological with her because I don't know how she feels. I am not on her side of her eyelids. I can't be philosophical with her. I know her for 10 minutes. I can't put my arm around her and in a very, understanding, paternal way say, Mrs. Martinez, you know we all die sometime. Or what is the word? Well, the Buddhists say, well, the orange falls and it rots, or the cucumber falls, or what, we have all these analogies, but I can't say that. I don't know her well. And then I see she's wearing a cross. And in that moment, I remember a story, a physician who's also a healer said to me about a doctor who offered to pray with a patient. And I had never done this before. So I said, Mrs. Martinez, I see you're wearing a beautiful cross. So I acknowledge that. Are you a prayerful person? And she said, yes. And then I said, well, would you like to have a prayer together? And she said, yes. Now what? So I thought, I want to draw from all our experience. I grew up in Detroit, Jewish family, not particularly religious. So I take her hands and I think, well, what would they do on TV? You know, you got to reach back to whatever wherever you can get your sources of wisdom. I take her hand and she bows her head, so I bow her head, so we're mirroring each other. This is part of joining. And I wait for her to begin, only she is waiting for me to begin. She is Catholic. She's from Mexico City. She is 88 years old. She is twice my age. We are from worlds apart. And yet, here we are together in this situation together. Why? Because I've said yes to being here with her. And I had no idea when I said yes what I was getting into, but yet here I am. But I can trust, each of us can trust when we get to that moment, we can trust that when we've said yes, there's something that we belong to that also trusts us and says yes back to each of us. So when we get into that moment, we can allow, and with our good intention, we can be there. So I start to offer a prayer. And I'd never done this before. And here's somebody from a whole different tradition. So I say, God, you who are the great healer. So she starts to now repeat after me as I'm thinking what to say next. Now I got to come up with the words that she's going to say. So even when we have all our experiences and our traditions and the comfort of all our liturgy and our prayers, when we're with somebody who shares that, it's going to be marvelous. But we're also going to be prepared to be with anyone. A spiritual care provider says yes to being with anyone, including those who are not like us. And so she starts to repeat, God, who is the great healer. And I say, be with us in our time of need. It's just spontaneous words. My tradition, most prayers are regular phrases, but these were spontaneous words from the heart. And this is part of the character of being a spiritual care provider, where we can take and we can improvise. We can take words that will be meaningful for her. We come to the end of our prayer, be with us in our time of need. Give us strength, guide the doctors and the nurses to do what is right and to do what is best. Thank you for hearing our prayer. Amen. And at that moment, we're still holding hands. She looks at my face, and down her face are tears coming down her eyes. Tears. And she looks at me and she says to me, thank you, doctor. Thank you. Thank you, doctor. Thank you. And what did I do? I didn't cure her. I did not fix her. I joined with her. I realized, in looking back, I allowed her to connect with her source of strength in that moment, to know that she is not alone. It lifted her up. It brought her to a place of gratitude. There was healing. How do I know? The color has fully returned to her face. And her spirit has gone from this anguish to a gratitude. This is healing. These are little moments of healing. And this is part of what we do. We inhabit from our heart, we move into these little moments with people who are in distress, and we join with them.